This is a really joyous and important day for us at Eastern Health as a health service. We are so very lucky to be joined by a number of people from our community and from our health service, and I thank you all for making the time. This is a fitting representation of what our first Reconciliation Action Plan is about. We also acknowledge a number of apologies today, which we appreciate given the current levels of competing demand, viruses in our community and other pressures that people have, and we thank them for their thoughts. As far as our order of proceedings today, we'll shortly hear from our board chair, Mr. Tas Musafaratis, and Eastern Health's Executive Director of Clinical Operations, Shannon White. Aboriginal Elder and our dear friend, Auntie Lou Bolch. And then we will have the opportunity for anyone else who would like to say a few words. And of course, there will be some light refreshments on the tables at the back. But first, I would like to give my sincere thank and welcome Auntie Joy Murphy, who will conduct a welcome to country and a smoking ceremony. Thank you very much, Auntie Joy.
But I would like to begin by saying meeting here at the new site of Yarra Ranges is exciting, and certainly together with the launch of the Eastern Health Reconciliation Action Plan is a lovely spot to do it on. Could I begin also by saying that we meet on the traditional land of the Wurundjeri Woiwurrung people, and today I'm very, very happy, extremely happy, because it is my father's country. It is my 3 children are here today, daughter Sharon, Jodie, son Craig, who's doing our barbarian, the smoking, and Craig's son Tate. So I kind of almost feel, that I've never had them, this many of my family at a gathering, so it's got to be a very special friend, and a very close family member of us is Martha Chandler, an elder of the beautiful PAG team that our Aboriginal health team runs from Healesville. I'd like to acknowledge the other elders present with us today, and it's great to have you along at such an important event and the contribution you make towards Aboriginal health and well-being. Also like to acknowledge each and every one of you, and there's a lot of Eastern Health staff here as well as Yarra Rangers, so acknowledge you and your belonging, and I pay my respects to all ancestors, elders and communities across this great nation and neighbouring islands. Had a bit of a chat with Ben a while ago about logos and just generally how things might connect, and so one of those was about a symbol, a logo, and it turns out that it is a very generic logo, which is great because that was the concern, and but for us it's neither male nor female, and also that it can be used in the way in which you want to use it. And of course, when speaking to members of Wurundjeri, they were more than happy to say, but of course health is a very important factor in our community, so we'd agree with that. So it was really nice to have that connection, but that approval also by Wurundjeri Ben, so thank you for doing that. Reconciliation action plans, can I say, are numerous. I don't know the exact numbers, but I was around probably in the first 20 or something, and it seems like the numbers have just shot out everywhere, and I don't know, there's probably at least 1,000 in schools, made by different schools, organisations, and plus more in other organisations and so forth. If you don't know much about reconciliation actions plans, it's in their consultation with our community, it was about just a step towards closing the gap, for want of a better word. But then taking that step in a slow process, and also taking those steps to understand and know that you could make a commitment. And it doesn't have to be in a certain time. We found out very quickly that people wanted to get to the elevate stage of RAP instead of the innovate, and we found that created a lot of problems. So we really pulled people up through Reconciliation Australia and the work that Karen Mundine does heading that up. So today's Reconciliation Action Plan launch really is something to be reminded of, situations that might need immediate answers. However, that can't always be. So, and that's in health as well. But I think in turning the pages, and I've seen the launch, I've seen the plan, and certainly I think it's a moment where we reflect. Certainly it's innovative, and also it's not action-packed, because that's not the way to go. It's about taking steps forward in a progressive way that will advance and have long-lasting effects or impacts for our community for better health and well-being. So I just wanted to say thank you, a big thank you to Eastern Health, because that's really important from I'm not speaking on behalf of Karen or Reconciliation Australia, Reconciliation Victoria, but for those that have worked in that area for a long time. It is getting very warm, so I'll move on. In terms of our welcome to country, Craig, as I said, is leading the barn bearing ceremony, which is about cleansing, and we'd invite you to come over after the Womenjaka, the welcome ceremony, to take your moment to cleanse yourself, to take your moment where you work, and that work is maybe becoming just a bit too heavy for you, your own lifestyle, and as we all know, coming up really quickly to the festive season, that you might just need to put something on your shoulder for a little while and wait until you're given permission, basically, to deal with that at another time that's appropriate to you. Significantly, it's about our ancestors with colonisation, that many of our people were killed and on site, and not necessarily on their own country, and were not given a burial. So we always hope that the barn bearing will send their spirit to their rightful place of resting. Also, we go on then with the Womenjaka welcome ceremony, which is from the gift of who we are, the Managum people. Again, we've got enough branches here for 1 million more people, but those of you who are here today, I'd like to offer you the gift of the gum leaf. In that we'll pass these around, and we'd ask you to take a leaf from these branches, and if you accept this gift, which we hope you will, I'd like to say Nojkudwa, thank you for accepting, and also to say that you join with us to honour the spirits of our ancestors who've nurtured this very land for a very, very long time. And also to the way in which, input the environment, the climate has changed, that sadly we're losing, so much of our ground, so much of the earth, so many of our animals, then it's time, and has been time for a long time, to start recognising that we can give back and hopefully rejuvenate and regenerate country to somewhat of it used to be. This leaf can be your gift, of course, but as we say in our culture, that what we take from country, then we will give that back. So if you'd like to do that, return it, then we ask you to place that in the smoking bowl, in the tana, and these ashes will be, there'll be just a place chosen where those ashes will enter back onto country, and then that way we can say that we're giving back to help in regeneration. Lovely to be here today. Thank you for having us. Our language is the Woiwurrung Waminjaka, Wurundjeri Balak, Yemen, Kundivik, and you are most welcome to the traditional lands of the Wurundjeri Woi-wurrung people. Not goodbye.
Good morning, everybody, and thank you for inviting me to speak here. I can't say how proud I am to be here this morning. Finally, we get to launch our RAP, and I know that a lot of people have been working on this for quite some time. I'd like to thank each and every one of you for your role in making this happen. And there are a couple of people I'd like to call out in a few minutes, but I do know that these things do take a fair bit of effort and quite a lot of work. And they also require leadership. And I'm really proud that our board, my colleagues, approved this and actually propelled this and provided the necessary support that's required to make it happen. A special call out to Annalee Cribbs and Bob Mitchell and the Ambos, who are doing a great job up there, hopefully. Both Annalee and Bob sat on the RAP Advisory Committee over a couple of years and made sure that there was a direct link back to the board so that we actually heard reports and could see what was going on. Special shout out also to Shannon. I know, Shannon, you're on the list to speak, but it does require executive support and leadership, and I know that you provided that, so thank you for the work that you've done. We have been talking about this for quite some time, and I reflect on the first conversation that I was part of, and we met with Mark Thompson. And Mark Thompson, he was just such an inspiration, I have to say. He really showed us why this is a really important piece of work for us to do together. And not only did he inspire us, but again, he gave us the permission to really want to go ahead with this and make sure that we did happen. And today we're launching this, and I'm really pleased that we're launching this today because there's a lot happening in the world at the moment. And it would be remiss of me not to acknowledge that we're in the middle of a national conversation at the moment about the voice. Wherever that lands and whatever it ends up looking like and whatever we might think about it, I think it's great that we are having this conversation. This conversation means that what is important is what will be discussed, whether it be discussed in Parliament, on the radio, in the press, in our living rooms, in our workplaces. This is an important conversation that we need to have about how we can actually work towards closing the gap. And the voice is only one tool towards that, whatever it might end up looking like. And in the end, it doesn't matter what it looks like. What matters more importantly is that we have this conversation and that we're all part of this conversation in this journey together. The other important contextual piece is that this morning I'm really pleased to say that the board approved the Aboriginal employment strategy. And this is a bit of work that I know a number of people, including yourself, Shannon, and your team have worked on this, along with Amanda's team through People and Culture. And this is going to help us to hopefully lift our game in being able to support and encourage more people to work in our organisation. Because what we do know is that it's not what we do for you that matters, it's what we do together that matters and is most important. So hopefully we can actually take this that next step forward. And the third bit of context I want to just mention is a personal one. And last week I took a week off work. There was an election in the state and I wasn't here for that election. I was actually climbing the mountains in the wilderness of Tasmania. I was on a small hiking expedition and our guide happened to be connected to people who were somewhere connected to the last known Aboriginal person in Tasmania, Truganini. And she actually showed us and told us many stories about the experience that Aboriginal people had in Tasmania. I found that incredibly enriching, humbling and disappointing at times, and incredibly hurtful. And again, it reminds me that this work that we're doing at Eastern Health is actually really critical. So I bought Truganini's biography, and it's my plan to actually take a bit of time out over summer and read that and learn a bit more about the experience that Aboriginal people in Tasmania and the footsteps that we followed actually experienced at that time. So I'm not going to take up too much more time. Each and every one of you here has been involved in this journey, and I thank you. I thank you on behalf of the board, and I thank you on behalf of myself as well. And I look forward to being able to report back over the next year or 2 or 3 on our successes and the way we've been able to actually increase our performance in the Aboriginal health space towards closing the gap. Thank you very much. And it's always great to see Auntie Joy. And Auntie Joy, it's great that you're here with your family as well. Thank you. Thank you very much.
So fabulous to be here and incredibly grateful. The sound of ambulance sirens, unfortunately, is one that we know too well, but very fitting with actually what is going on in our world right now. I remember starting at Eastern Health, which is nearly 4 years ago, and David saying to me, oh, by the way, we'd like you to lead a reconciliation action plan, and if you don't mind, can you move it along? And at that time, amongst everything else in my portfolio, it seemed like an incredibly enormous task. But what I did find out, which we all know, is that it does take a really long time. And it takes a really long time for us to understand as non-Aboriginal people exactly what reconciliation means. And as Tash described to you all, the conversation and the leadership that Mark Thompson has showed not only to our board, but personally more so to me in terms of a coach, but also a friend in supporting me to ask questions that in my mind initially were silly or embarrassing questions, but he always made me feel safe and supported in understanding and being a lifelong learner around Aboriginal and Torres Strait Islander culture. In wave 2 of COVID, I spent many hours in one of our outbreaks in Kirkbrae Residential Aged Care Facility. And most weeks I would link up with Ben and with Mark on a conversation in the car about continuing with our work with the Reconciliation Action Plan. And despite stopping many things at that time with the outbreaks that COVID presented with us, the lockdowns, the numbers of people that were very sick and in fact were dying in our community, what I also understood was important that our community remained engaged in something important. And so I know it's not okay to have a favourite auntie, but Auntie Lou, I just wanted to acknowledge you. And to all the aunties here, you're all my favourite, by the way. But Auntie Lou, I thought of you a lot as we were going through that time, because I know how difficult it was for you in lockdown and for all of you in lockdown. But what would be important to you to keep going? And I think the RAP was one of those things to keep engaged in. So I just wanted to say thank you. There were other people obviously involved at that time. I think we had really good governance and still have good governance. And I want to call out a few of those people that were involved right from the get-go. Merrin Aldist, Marilyn Duff, Ben Davies, our board directors Annalee Cribb, Bob Mitchell. We also had Elka Smurl, Auntie Lou, who I already spoke about, Ralph Hume and Mark Thompson. Given the time that this process has taken, as I said, we're almost up to, I think it's about 3.5 years. A lot of the roles and responsibilities have changed, but this initial work and the planning was so important to get underway. I'd also like to thank Simone Thompson, who I know can't be here today, but her beautiful artwork, which is Kabering Yirumboy, Beyond Tomorrow, which is here today and looks fantastic actually against these colours. And it was specifically commissioned for our Reconciliation Action Plan. In terms of what our Innovate RAP focuses on, we have 4 key themes, 6 action areas and more than 150 specific deliverables. So we know that this is not going to be easy, and we need all of you beside us to lead the work. I'm really excited today to finally launch our Innovate RAP. And as David and Tass have both expressed, I remain incredibly committed to the journey. Thanks everyone.
My name is Lucia Walsh. I'm a Monero Ngarigo Gunai woman and elder, and I have lived here on Wurundjeri land in the Yarra Ranges since 1967. And thank you to Auntie Joy for your beautiful welcome this morning. Very inspiring, very heart-wrenching, and it's so beautiful. And thank you for sharing your beautiful Wurundjeri country with other nations and to settler nations, and for your continuing care of country and of the little creatures that live in the trees and the rivers. Since the time I have lived in the Yarra Ranges, I have seen the development of housing estates, growth in population, and a notable increase in Aboriginal population to the eastern suburbs. With an increase in Aboriginal population came the increase in the need for healthcare and services that are culturally safe, responsive and accessible and equitable to the local Aboriginal community. Eastern Health has recognised this need and has committed to the Reconciliation Action Plan. This plan has taken over 3 years of hard work by a committed and determined RAP committee. COVID delays did not make it any easier, but the passion, respect and determination of the committee did. I actually believe, and this is my belief, is that the process of reconciliation actually began about 8 to 10 years ago by the employment of Aboriginal and Torres Strait Islander people into the Eastern Health workforce. For example, the Aboriginal liaison workers delivering advocacy and cultural support to Aboriginal patients within the hospital system, and also to our mental health, social and emotional wellbeing team, giving our Aboriginal men and women the opportunity of traineeship in partnership with Charles Start University to gain a bachelor degree to work in the role as mental health clinicians, working with Aboriginal consumers who assess any of the Eastern Health mental health programs. Investing in Aboriginal workforce is an investment in health, wellbeing and safety for all Aboriginal and Torres Strait Islander consumers. I'm happy to say that this RAP formalises the partnership between Eastern Health and the Eastern local Aboriginal community and their organisations. I'm also pleased to say it also includes Aboriginal people in all levels of decision making, including membership on key decision making committees such as the Aboriginal Advisory Committee. And I would like to say thank you to everyone in bringing this RAP to be a living document, and to thank everyone for what each and every one of you do in your efforts in closing the gap in Aboriginal health and wellbeing. Thank you.
Thank you all very much, and really, again, want to thank you for taking the time out today to come to the launch of our RAP. And I call it our RAP rather than the Eastern Health RAP because that's what it is. It's our collective Reconciliation Action Plan. This concludes the formal part of today's proceedings, and I just wanted to finish off by saying that today is an incredibly proud day as I stand here as the CEO of Eastern Health and add my voice to the commitment of reconciliation journey that we are on. Nothing could be more important than the health and wellbeing of all, and whatever we do to make that better cannot be enough.